Hello colleagues, my name is Christian Reich. I'm a dermatologist here in Hamburg at the Dermatologum, where we do this little video to raise the interest of a paper that we recently published in the British Journal of Dermatology. What is our paper about? It is about a new tool called the Topical Treatment Optimization Program, or short TTOP. A tool that consists of a structured communication between HCPs and the patients, help desk material and also information material developed together with patients. The whole idea of TTOP is to overcome non-adherence. We know that non-adherence is a major problem in dermatology in the topical treatment of diseases like psoriasis. The new thing here is that we tested the value of the TTOP intervention in a large randomized controlled trial where one arm of patients received standard of care, the other arm received the TTOP special care, if you will. And in order to avoid confounding, all patients received the same topical therapy, which in this case was the fixed combination of calcipotriol and betamethasone as a gel, because we know that this gel is a very acceptable treatment for patients. 1,790 patients were randomized to go in either of these arms. Study sites were distributed all over Europe. In addition to the classical outcome, the clinical outcome here was the physician's global assessment, we created special outcomes like the topical treatment adherence questionnaire and the patient preference questionnaire in order to assess elements that we know would influence adherence. The primary endpoint was at week 8, but the whole study duration was 64 weeks because I considered it important to have both short-term and long-term outcomes. The percentage of patients achieving a physician's global assessment of clear or almost clear at week 8 was the primary endpoint. We saw in the TTOP arm 36% of the patients achieving this, in the non-TTOP arm 31%. This is despite the fact that in the TTOP arm patients actually used a little bit less drug than in the non-TTOP arm. So we can say that this tool that gives you a structured communication that tries to overcome non-adherence gives you a better clinical outcome because the difference was statistically significant. And by the way, the difference remained over the 64-week period of the study. Using the TTAQ, this adherence questionnaire, and the patient preference questionnaire, we could also identify that patients in the TTOP arm scored higher on main parameters that we know influence adherence. So my interpretation would be that a tool that improves adherence gives you a better clinical outcome, despite the fact that patients use a little bit less drug at week 8, but also long term. Well, first of all, it's according to my knowledge, the largest well-done high-quality clinical trial that in a randomized way shows that a tool specifically designed to overcome non-adherence gives you a better clinical outcome. Now, if you go back to the patients and ask them, what do you rate most important from the TTOP intervention? They say, first, the communication with the doctor, second, the communication with the nurse. So the communication between the healthcare provider and the patient, that is what drives the success of the TTOP program. I never learned communication when I was in medical school. It is probably telling us that learning communication, trying to optimize and make our communication with the patient most efficient is something we should do on top of selecting the best possible drug for the patient. Maybe in the future a spray instead of the gel, other things. But the communication itself, this is where we need to be good at, and this is where we need to improve even further in the future.